Hi, Karen Damshin from Damshin Financial Planning, here with a little health insurance update this week. So the Trump administration has issued its first major set of proposed changes to the Affordable Care Act. That came out in March, and we have a commentary period that goes until April 11th for those changes. So policy experts have indicated that these changes could make it a little more difficult for consumers to sign up for coverage, could potentially reduce enrollment. So we had about 24 million Americans who signed up for health insurance under the Affordable Care Act in 2025. This was record enrollment levels. So we also had a whole bunch of fraudulent activity going on that resulted in about 274,000 consumer complaints just through August of 2024. And a lot of this centered around fraudulent enrollments, other bad actors, and these are complaints that get reported to the Centers for Medicare and Medicaid. So the Trump administration has said that these new regulations would include critical and necessary steps to protect people from being enrolled in marketplace coverage without their knowledge. Of course, we think that we could see definite paperwork barriers to this, and it could change a few things that we've become used to over the past few years. But the crux of this is this idea of should people who sell insurance policies, like health insurance policies, be required to be fiduciaries in the same way that we have fiduciaries on the financial side of the house. So a good health insurance broker or agent will be contracted with many, many companies so that they can offer the best possible plan for their client. And if the best plan for their client is not one that they are authorized to sell or contracted to represent, they are still required as part of our licensure to make sure that they communicate that information to the individual who's enrolling. So some of these new proposed changes include potentially requiring brokers and agents to act truly in the best interest of their clients. That is why I've been contracted with so many companies for so many years. And we go through that annual training and recertification with all these companies every year, because that way we can make sure that we're getting the best information and the most information and education out to you. So some of these new proposals that Trump is suggesting could eliminate the year-round period for special enrollments for people with really low incomes, could affect the people who have dreamer status in the country from being able to have a special enrollment period. And it could even put some stipulations in place that could help warn consumers if they've been unknowingly enrolled in an Affordable Care Act, such as instead of you potentially having a zero premium on your health insurance, you would be required to have at least a small bill, so you would receive a notification of that if somebody enrolled you fraudulently. We could see some of these new changes be a barrier. And one of the big ones that's been proposed is taking the health insurance enrollment period back. So today it is 75 days. For 2025, it started November 1 of 2024, and it ended January 15th of 2025. But they may choose to roll that back, where for 2026 plans, open enrollment might start November 1 and it might end December 15th. So we would potentially lose that additional 30 days of enrollment. And also under these new proposals, there is built in this idea that gender affirming care would not be considered one of the essential health benefits of the Affordable Care Act. So as we continue to watch all these changes go through, we definitely pay attention to the fraud, waste, abuse is a big part of cost in healthcare. So we want to make sure that anybody enrolling in a health insurance plan, that it's happening with their knowledge and all above board. So as we continue to watch these changes go through, we'll keep you updated as laws and policies change. But for now, of course, if you have any questions about your health insurance policy, please don't hesitate to reach out. Or if we can answer any other questions, I'm always here to help. Thanks so much. We'll be back in your inbox next week with another update.